Doctors reveal these 5 health screenings after 70 may be riskier than you think. Have you ever asked yourself, at this age, how many more tests do I really need? How many checkups are actually helping me? And how many are just making me more anxious? I once had a patient named Walter. He was 78, full of humor, and he said to me one day, "Doc, every year I go in for scans, scopes, blood work, you name it. But the more I check, the more I worry. I don't even know if I'm staying healthy or just driving myself crazy." And that question stuck with me. You see, Walter isn't alone. There are millions of older adults quietly wondering the same thing. They're getting tests that, honestly, may not be necessary anymore. In fact, some of them can do more harm than good. As a doctor with over 30 years of experience, I want to speak to you plainly, with no sugarcoating. There are certain health screenings that just aren't worth it after 70. And sometimes, the smartest move to protect your health is to do nothing at all. If you're in this stage of life, or if you have aging parents or loved ones, this video is for you. Stick around till the end, because one single decision might just save you from an unnecessary surgery, a risky medication, or simply give you more peace of mind. And if you find this message meaningful, hit that subscribe button. Each week, we'll talk not just about health, but about how to age wisely, calmly, and with dignity. 1. Brain MRI just for mild forgetfulness. Have you ever forgotten a familiar name? Or set your keys down and just couldn't remember where you put them? I've heard this story hundreds of times from my patients. And every time, their eyes show the same thing: worry. "Doctor, am I losing my memory? Could this be Alzheimer's?" I totally get that fear. Once we hit our 60s or 70s, even the smallest memory slips can feel like a red flag. So, naturally, a lot of people either ask for, or are told they need, a brain MRI. It sounds high-tech, accurate, reassuring. But today, I want to tell you a truth most doctors won't say out loud. One of my patients, George, 74 years old, a brilliant, kind retired mechanical engineer, still took his morning walks, played Sudoku every night. Then one day, he told me, "I've started forgetting my neighbors' names, and it scares me." I listened, and he was referred for a brain MRI at a major hospital. The results? The scan showed some small white spots, what they call white matter changes. Now here's the thing. Those little spots are completely normal for older adults. But no one explained that to George. Instead, he spiraled into fear. He stopped driving, avoided friends, convinced himself he was falling apart. Another doctor even suggested a spinal tap, just to check, even though George showed zero signs of serious decline. Let me hit you with a stat that might shock you. According to Neurology Today, 86% of people over 70 show some abnormalities on a brain MRI, but only 3% of those are related to anything dangerous or needing treatment. That means 97% are just aging, naturally, normally, but they get told words like lesions or degeneration, and it plants fear where there shouldn't be any. Imagine this. You take your car to the shop for a tune-up. The mechanic sees a tiny scratch on the door and tells you to replace the transmission. Would you do it? But when it comes to our brains, it's so much easier to panic, because that's where our memories live, our feelings, our sense of self. So if you've noticed yourself being a little more forgetful lately, take a breath. It's extremely common, and most of the time, it's not dementia. In fact, one simple, low-cost, low-stress tool is way better than rushing to an MRI. It's called a cognitive screening test. Just a few questions on paper. Takes 10 to 15 minutes. Checks your memory, focus, and thinking skills. And if you truly want to keep your brain sharp, forget the machines. Forget the meds. Start with your lifestyle. Here's what I always recommend to my patients. Get 7 to 8 hours of sleep every night. Stay hydrated. Move your body, especially with aerobic exercises. Stay social, talk, laugh, play games, tell stories, even write poetry. Your brain is like a muscle. The more you use it, the stronger it gets. Look, I'm not against MRIs. They're valuable if there are serious symptoms like seizures, personality changes, or significant mental decline. But if you just forgot your grandson's name for a second, or missed a lunch date. Don't jump into the MRI machine just yet. Start with the basics. Small changes can lead to huge peace of mind. I still remember when George came back 3 months later, after meditating, sleeping well, and being kinder to himself. He smiled and told me, "Doc, I remembered 7 out of 10 things on my grocery list." And I laughed. Well, that's better than me most days. If this story feels familiar, share it. If you've ever worried about aging too fast, I want you to know you're not alone. Thanks for listening. And remember, your memory isn't just stored in your brain. It's in your heart, your habits, and how you live each day. 2. Full body CT scans with no symptoms. Let me paint you a picture. You're feeling totally fine. No symptoms. Nothing to worry about. But then someone says, "Hey, why not get a full body CT scan, just to be safe?" You never know. It might catch something early. Sounds smart, right? Better safe than sorry? I get it. I've heard this countless times from patients, especially those over 60. Family members start worrying. Friends whisper things like, "Get checked, just in case." And suddenly, you're booked for a scan you never even needed. But here's what most people don't realize. One full-body CT scan exposes you to the same amount of radiation as 500 chest x-rays. Yes, 500. Let that sink in. I remember one patient, Mr. Thomas, 63. He went in for a just-to-be-safe CT scan, suggested by a friend. They found a tiny shadow on his lung, a harmless little spot, probably an old scar. But that single finding led to a biopsy, for days in the hospital, and weeks of anxiety. In the end, not cancer, nothing dangerous, just a benign scar from a past infection. And yet, that harmless, extra checkup turned into a full-on medical roller coaster. Here's the truth. Most of the time, when you don't have symptoms, a full-body scan does more harm than good. You might uncover what we call incidental findings, weird little things that aren't dangerous. But once they're spotted, doctors feel pressured to investigate. This leads to more tests, more stress, and sometimes even unnecessary surgery. And here's a number that might shock you. According to research, about 5% of all cancer cases in the U.S. are linked to the overuse of diagnostic imaging, especially CT scans. That's the same cancer risk as heavy alcohol use. Let that comparison sink in. No one tells you this, but as a doctor with over 30 years of experience, I feel it's my responsibility to say it out loud. I don't want you to live in fear. I want you to live with wisdom. When there are no warning signs, a CT scan is often not helpful. In fact, the peace of mind you're looking for might actually come from not doing the scan and choosing instead to trust your body. Focus on healthy daily habits and get guidance from doctors who tell you what you need to hear, not just what you want to hear. So next time someone suggests a full body scan, just to be safe, remember this. You don't need a machine to prove you're healthy. You need calm, common sense, and the courage to say no thanks. I'm Dr. Kevin, 60 years old, and from the bottom of my heart, I want to tell you, don't let an unnecessary scan steal your peace. Choose smart. Choose balance. Choose peace. 3. Stress test, when your heart doesn't need to prove anything. Let me take you into a moment. You walk into your annual checkup. You feel great. No chest pain, no shortness of breath. You walk the neighborhood every morning, still active, still sharp. But then the doctor looks at your age, 60, 65, maybe 70, and says, "Let's do a stress test, just to be sure." Sounds reasonable, right? I mean, the heart is everything. But here's the thing. Just because something sounds reasonable doesn't mean it's necessary. I've been doing this for over 3 decades, seen thousands of patients, and I can tell you, not every test that sounds smart is actually helpful. I remember a patient named Walter, 67 years old, fit guy, loved gardening, played golf, never had a single complaint about his heart. But during a routine visit, his doctor said, "Let's do a stress test, just for peace of mind." Walter said okay. A few days later, he came back to my office, face pale, voice shaking. The test came back positive. They want to do an angiogram, maybe a stent. That's when I stepped in. See, stress tests have a false positive rate of up to 40%. Let that sink in. 4 out of 10 people who get a positive result are perfectly fine. That's according to research published in JAMA Internal Medicine. So I asked him, Walter, do you get chest pain when walking upstairs? No. Do you feel short of breath on long walks? Not all. Ever feel dizzy or faint? Never. Then why were we talking about catheters and stents? That single test, that one just in case, had opened the door to a whole chain of unnecessary interventions. Stents, blood thinners, hospital stays, stress. And here's the worst part. Stents don't help people without symptoms feel better. They don't help them live longer either. But they do come with risks, bleeding, kidney problems, infections, complications. Now, let me be clear. Stress tests aren't bad. If you have symptoms, chest pain, unexplained shortness of breath, a history of heart disease, then yes, by all means, get tested. But if you feel great, no warning signs, then take a breath and ask yourself, am I doing this test because I'm truly at risk or just because I'm scared? Walter made the choice to skip the invasive tests. Instead, we monitored him regularly, stayed in touch, and guess what? 3 years later, still healthy, still happy, still playing golf. No stent, no pills, just knowledge and the courage to say not now. Friend, I'm not telling you this to scare you. I'm telling you this so you can understand. Sometimes doing nothing is the wisest choice. Ask yourself, will this test make me healthier or just more anxious? Is there a gentler way to keep track of my heart? Am I testing for reassurance or feeding my fear? As a doctor, I've learned something far more important than just treating illness. I've learned to listen. Listen to your body. Listen to your fears. And most importantly, listen to what really matters to you. Because sometimes, a strong heart doesn't need a treadmill to prove it's working. It just needs you to trust it. 4. Bone density scan, DEXA scan. Have you ever opened a medical report and just reading the first line made your heart skip a beat? I'll never forget the worried look on Mrs. Helen's face, a 74-year-old retired teacher who spent over 30 years in the classroom. She came to me holding her DEXA scan results. That's the test for bone density. Doctor, they said I have osteoporosis, she said. Do I need to start medication right away? I looked at her and smiled gently. Helen, gray hair, wrinkles, and a bit of bone loss, those are just gifts that come with the blessing of living past 70. You see, it's perfectly normal for our bones to get a little thinner as we age. It doesn't mean your body is broken. It means your body is evolving. The sad part? Modern medicine doesn't always leave room for what's normal. Here's the trap. Many seniors get a DEXA scan, get labeled with osteoporosis, and are immediately put on medications like bisphosphonates. Sounds fancy, right? But behind that medical jargon lies a chain of side effects that, as a doctor, honestly trouble me. I once treated a patient who developed jawbone necrosis from those meds. Eating became painful. She lost weight. Her mood sank. And unfortunately, her story isn't rare. Have you ever wondered, maybe more medicine isn't always better medicine? Sometimes, the best solutions are the simple ones. When a patient has mild bone loss, I usually recommend starting with 3 basic things. Sun daily vitamin D. Woman walking gentle strength training or brisk walks. Leafy green natural calcium-rich foods like sardines, kale, or yogurt. Sounds too simple. Well, that simplicity is actually the safest, most sustainable way to protect your bones as you age. Think back to the first time you held your grandchild's hand. If you want to keep holding them, keep walking with them, keep dancing at family parties, it all starts with caring for your bones in a gentle, smart way. Now, I'm not saying you should skip the DEXA scan, but before you panic over one number, ask yourself, will this change how I live my life? Or will it just give me one more thing to worry about? You don't need a machine to tell you your body's worth. What you need is knowledge, wise choices, and someone to remind you. Growing older doesn't mean growing weaker. It means growing wiser, stronger, and yes, more resilient than ever. 5. Colonoscopy after 75. Is it still worth it? Have you ever received one of those letters saying, it's time for your colonoscopy? and felt like you had no choice. Screen for cancer now. It could save your life. Sounds urgent. Sounds responsible. But hang on just a second. Here's what they don't often tell you. After age 75, the risk of complications from a colonoscopy is actually higher than the chance it'll save your life. I know that might sound shocking, but that's the part most seniors never hear from their doctor. I once had a patient, an active, healthy gentleman in his late 70s, who went in for a routine colonoscopy. Everything looked fine until it wasn't. He suffered a bowel perforation during the procedure and ended up in emergency surgery. What was supposed to be a simple screening turned into weeks in the hospital, intense pain, and a serious hit to his mental health. Now let me be clear, I'm not anti-colonoscopy. But after 75, you have every right to ask, is there a safer way? And guess what? There is. And it's much simpler than you think. It's called the FIT test, a stool test you can do right from home. No anesthesia, no fasting, no tubes, no hospital visit, and no stress on your body. All it takes is a tiny stool sample sent to the lab. If something looks off, then you can explore further testing. But you're not jumping into something risky right away. Smarter health choices aren't always about choosing the most aggressive option. They're about choosing what's right for you, for your age, for your body. If you're over 75, you've lived long enough to know this one truth. Not every recommendation fits every person, and especially not every person over 75. Ask your doctor about the FIT test. Ask for options. Don't just follow instructions. Make informed decisions. Because at the end of the day, your health isn't just about lab results. It's about how you feel each morning when you wake up. Clear-headed, comfortable, at peace. You know what? After 70 years of living, you don't have to do things just because someone told you to anymore. You have the right to choose what feels right for you. Not every test is necessary. Not every piece of advice needs to be followed. And not every worry deserves your energy. What you truly need might not come from a prescription bottle. It might come from listening, really listening, to your body. In each deep breath, in every simple, nourishing meal, and in the stillness that aging offers, like a quiet gift of time. I'm not here to tell you what to do. I'm just here to remind you, you're not alone. There are many others, just like you, learning to slow down, make wiser choices, and care for themselves from the inside out. If something in this video resonated with you today, share it with a friend. And if you found it helpful, leave a comment below. I'd really love to know what's on your mind. See you in the next video, where we'll keep walking this journey together, not just to live longer, but to live deeper.